Hello, my dear friends. Welcome to Aspire32. After many days, I have another very important podcast because I know my subscribers, my viewers are asking me to make more videos, and I have a very, very important topic today. And today's topic is about UK, and today I have one of my very good colleague, that is Dr. Neda. She is practicing in UK from many years, and welcome, Dr. Neda, to this podcast on Aspire 32.
Thank you, sir. It's a privilege to be here.
But let me first introduce, to my speakers, my viewers, that Dr. Neda is alumna of KL Institute of Dental Sciences, where even I studied and I'm the faculty now. But after that, she has a very big CV. She finished her ORE exam, and she's even ORE examiner, and she has done her various certification degrees. And it's an interesting journey because I remember her as a being very energetic, 1 year junior to me, but very energetic, colleague of mine, and she has been doing so many things. So the obviously I don't want to take a lot of time, just explaining the CV. I'll put it in the description, but I want to listen more from you, Dr. Neda. First question which I have for you is, how did you get this thought that I should go to UK? Because I know we all used to do that internship in that KL Dental College. I personally had no vision of mine, until I came to internship and I met few people who had this who had done something. How did this thought came in your mind?
So it started with a rejection, actually. My US got rejected because I wanted to try and go into the country, explore it before I actually think of studying in a country, which a lot of people they apply and they go there and study. So US got rejected because I applied for tourist visa just to explore the country and then go forward with something, a life-changing decision like studying there and pursuing education. Meanwhile, I was practicing in Bombay and Gujarat for a few years, but there was something else I wanted to do, and I always wanted to go abroad because of opportunities. I know life and system is different, and always my family said, you're going to go abroad. So for personal reasons and professional reasons, then I chose UK. I started with my master's in dental public health in the UK, and here I am today.
Yeah, that's nobody knows where is our future, but I believe that your family knew that you would move abroad, and that is I believe that your family was very supportive. So it is surprising that the visa got rejected for US, because I don't know, there are many students who face this difficulty. But the good thing is, that led you to another path, and finally you settled well in UK. So how did this UK journey started?
UK journey actually started with applying for dental public health in King's. So I applied for dental public health because I didn't want to go for anything like MPH or finance just to get into UK. I got through King's very easily. Actually, the process was easy. Once you have your visa sorted, it's easy to be here. And then meanwhile, after the course is intense. The master's course in UK is very intense. So there was no way I could have cleared my ORE. But meanwhile, I got to know the system, the country, the people, the culture. And then I was like, okay, yes, it is possible to be here. Let's just, plan future year. And then I started preparing for part one. While I was doing part one, you would be shocked to know that I also was nursing. I was a dental nurse. And that was my way of getting experience into the system, because there's no other way you can come across a patient or next to a patient unless you are on a course, and that was dental nursing then. Passed my part one and then applied for part two, and that happened within a year. And I became a hygienist first, and then until I, found a job as a dentist, then I did dentistry. So it has been a long journey. It seemed very hard in the beginning, but it was all worth it. And now when I look back, if I had to erase not coming to UK and stay that comfortable Neda in India, I wouldn't have done it, because I'm a completely different person and clinician now because I've come here.
Absolutely. And I think that is the struggle which is speaking, that is the joy that you have sailed through this struggle and you have achieved those things. And that is what I think all youngsters should realize, that success is not overnight. Especially when it comes to that people want to go abroad. It's a long journey, and people who are ready to go through this long journey, I think, will eventually succeed. And you are the right, you are the example for it. So this route, what you said, that I know that ORE part 1, part 2, majority people take it, but do you still advise people or the youngsters who have no idea that how do I go with ORE, or they are confused? Can they still take this path of public health and go ahead?
See, when it comes to UK, it's not like US. With UK, visa is a very important criteria. You can come to UK, take up any course, but if you don't have the visa to stay, you can't work here, you can't practice here. And also with dentistry, unlike you can do double PhD, you could be a specialist in your country, but if you come here, you have to still go through either ORE or LDS. It should be either one of these exams. So there's no way they're going to let you practice unless you pass these exams. So I think most important factor is the visa, because without a visa, you can only come here, study, maybe be here for a year or two, and then you have to go back. So people come here on student visa while they pass the exams, and then they get sponsored. Or if you want to risk it, then get married, find someone, and become dependent. So that's another route. But just joking. Yes, visa is the most important criteria to be in the UK and practice dentistry.
But what is the advantage of doing the public health? Will it help you to prepare for ORE better? If to help you to stay in UK?
My reason was personal. I did not want to do any other like MPH. I did not want to do MPH. I did not want, like my friend came here doing a management study in finance because it was just cheaper. It was 5 lakhs Indian rupees, and he could still come into UK, and he did that. But I did not want to do anything but dentistry. Now, clinical dentistry I could not afford it, because the same money I would have put in clinical, I would have put in my exams and passed my exams and work. So I chose dental public health. Number one, it's a 1-year course. Number two, it's to do with dentistry, and that was my most easiest and convenient option at that time.
And how much, if you can tell me, how much is dental public health? So I'm actually surprised, because I have only heard about the public health, which is Master of Public Health, and first time I'm hearing something called as dental public health. So can you tell me something more about it, and how much finance is involved? And can they get a work visa after they finish this dental public health?
So dental public health is to do with, obviously, public health dentistry in the UK. It's mainly if you do dental public health, and if you get a job of working under a consultant for 3 years, you can join the specialist list and you can become a dental public health consultant, which is mainly to do with policy making, public health dentistry, research and all those things. And then sometimes you also get sponsored into, getting a PhD position, and you can have the desk job if you don't like clinical dentistry and you just want to become a consultant in dental public health. Yes. Regarding the fees, I paid just the tuition fees were around 25 lakhs. And that is why it was the cheapest course in dentistry that I could take in, just to come to the UK and see how the culture and system of UK is. But it's not cheap. As compared to their local graduates, I think we international students pay a lot, 3 to 4 times more fees to get into the same course. But overall, I think the type of education they have here is quite different than what we have back home. It's more evidence-based, it's more research, it's guidelines, it's principles. So it's different, it's tough, it's intense, but it's worth it.
Right. So that is one option I think you have given to the students, and you said there are 2 routes to become a dentist in UK. One is giving the GRE, and I think there is another exam also which students keep on asking me, and I'm not aware, because we have done one podcast on our channel which was on ORE. Can you tell me what are the current options for students to become a dentist or practitioners to become dentist in UK?
So as I said, you could be a specialist or a PhD holder back in India, but you still have to give 2 exams to practice dentistry. Now, before I go into the 2 routes, I must tell you that there's a lot of transition happening in the UK with regards to overseas dentists. With Brexit, with COVID, a lot of changes are going to happen. So whatever I say today may not be applicable after 6 months. So please make sure that you go back to certain websites like GDC. I'll quote it in the captions below, but then whatever I say today is based on what I have today. So there are 2 routes, obviously ORE and LDS. Since COVID, what they had started doing was they were allowing our dentists to practice as hygienists and therapists, which got literally shut down last week. So now you don't have that option. Otherwise, you had that option of practicing as hygienist and therapist. You just had to get your degree, shown. The equivalence had to be shown that it's equivalent to what a hygienist and therapist would do in the UK. However, there is no way you can be a dentist practicing in the country without the two exams, which is ORE, that is by the General Dental Council, and the LDS, that is by the Royal College of Surgeons. Now, ORE, they are having massive, consultations and surveys and talks are going on that they want to slam the exams, which means they want to find an easier and convenient route for dentists from overseas to get registered. And what they are thinking now is, why not have colleges and universities from in and around the world to be approved for registration of dentists, or maybe get them here and have authority or bodies or practices to approve them as dentists. So what they want is to match the standards of care here, basically. So right now it's undergoing a lot of changes, and we'll have to wait until the end of this year, probably even next year. I'm not 100% sure. LDS, again, it's a 3-part exam now. It's part 1, part 2. It's same like the ORE, but then you only have these 2 exams. And unfortunately, after COVID, things have changed so much that they're canceling the exams. There are hardly any exams. We don't have dates after April for ORE. We don't know. They are giving preference to candidates who don't have. There's a deadline of 5 years that they have to finish the exam. So they're pushing them to give the exam. So at least there's no disadvantage to these candidates. But yes, as I said, there are a lot of changes happening, and I'm hoping that it's for the good of our people and our dentists, and it's easier for them to come.
Okay, this second route, currently is it still open, or even that is getting postponed?
It is open because it's by the Royal College of Surgeons, but it was anyways, the number of exams were fewer as compared to ORE. So anyways, it's one of the preferred route as well, but it's quite competitive to get into it.
So you prepared for your ORE exam, and you are an examiner for ORE now, if I'm not wrong. What is the best advice for international students? I know, I don't know whether you can speak about it, but suppose, as if you remember your days of preparation for ORE, do you think that this experience of working as a dental nurse helped you more, or anybody actually can India, maybe there is a coaching institute and they can prepare well, or what are some tips which you want to give to our students?
So I've been mentoring people for ORE just voluntarily even before I became an examiner. Obviously now I'm very strict with how much I can give information about, but I always give an analogy of driving a car. If I give you my car to drive in the UK with all the rules and the regulations on the road, you probably won't be able to drive until you know exactly what are the rules and regulations. Dentistry is the same. My only advice to people is, you are dentists. Stop thinking that you are students. You're not dentist students. You're already dentists. So that inner confidence has to come with you, because all they want is someone confident and someone who can communicate confidently to their patients. And it hurts me because somehow people, and I was the same, and that's why I know what it feels like giving the exam, because from being a dentist who has been practicing and has more experience than the graduates here, we come back thinking we are dental students and we are giving exams. Just because we have to give the exam doesn't mean we become lesser a dentist than they are. So my number one advice is, stop thinking you are back to dental school. You are dentists and you're giving this exam just to prove that you understand their system, and you have learned in a way that you can deliver the same kind of care or the same standard of care that they are giving to their patients. So yes, that's my number one. And obviously, like any other exams, it's going to be hard. It's your mindset as well. There are 2 things. You work on your skill set and you work on your mindset. I think the successful ones are the ones who can work on their mindset and focus in a way that dentistry will never change. There are only certain diagnoses. You can only have pulpitis, periodontitis. You can have, there are no new diseases or conditions in dentistry. So as long as you know those conditions, you just have to show them that you know it and you know what to do if a patient presents to you with a problem. So yes, mindset is everything, and skills can be learned anyway. So skills can be acquired, but it's the mind that you need to take over actually in the exam. And that's what they actually mark you for. They mark you for your confidence and for your communication.
And how do they develop a good confidence and communication skill? Because I think you have done some certification courses on leadership. I saw in your resume that you have done one from Manipal. And do you think doing such courses simultaneously while giving ORE or before ORE, does it help them to grow as an individual?
So, Suresh, initially I would do more courses on dentistry. I would upgrade my skills. But then I realized even if my skills are upgraded, there is something inside me that doesn't allow me to deliver it or implement those skills. And that was to do with communication and self-confidence. Then I started, diverting my focus to mindset courses and leadership courses because I wanted to sound my body language, the way I spoke, the way I came across to someone in a foreign land in a different culture, because we might say things, it might actually come across differently. So the good thing about UK is there are people from everywhere in the world, and English is probably not the first language of so many countries in the world, but everyone speaks English differently. They use different vocabulary, the way they speak. So it does come across differently. So I started actually working on my communication skills and the way I came across. That's why you see a transition of courses from skill set to mindset. And then it was more about how I came across as an individual to my patients and to other people here. Yes, it does help though. If you ask me, I think every dentist, it's dentistry you have to be a good businessman, you have to be a good artist, you have to be a good doctor, you have to be a good dentist. But in the UK, I think dentistry, you have to also be a good lawyer. So whatever you say, the words that you use, the way you document things, everything is it's too much in one profession here.
Okay. I'm sure those important tips are very helpful to the student, because I know I could ask you more questions about the steps of ORE because we do have covered it in a separate podcast. But these are the things which are very important, because everybody can say that this is the exam, this is the application process, but it is the experience which makes it different. Nobody is speaking something new. The information is always there, but it's the experience which makes a difference. So you completed your ORE, and how much time generally this ORE it takes to appear, complete? 2-3 years?
So the part one is basically theory. So part one, LDS and ORE, both are theory exams. It depends how nerd you are. I think most of us do clear the part one. It's about getting a place also. The part two, however, is based on your skills. So there are different components. LDS has got 3 components in part 2, and ORE has got 2. So they have changed LDS as well a little bit, and I don't want to tell too much here because it's all online. And if anyone wants any help, I am so happy to help you voluntarily, because I don't want anyone to go through the stress and struggle that any one of us. Just get in touch. The part 2, it all depends upon your first, number one, whether you get a seat to obviously give. But the main thing for both ORE and LDS is your mannequin, which is your hands-on operative dentistry skills, and they are quite strict about that. The dental treatment planning, the OSCEs, the medical emergencies are something that you can study. You can, the way you practice talking, you rehearse conditions, dental diseases, how to, present them to your examiner. But mannequin is something you have to work under stress, and it's the stress that you need to calm your nerves down when you're doing it in the exam. So that's something, if you can get it right in the first go, I think both can be done within 2, the minimum is 2 years. The maximum would be 3 years, but there are some people who give multiple attempts, because I know periodontists, they've not cut a cavity for years, and they have to do class 2 with the perfect proximal box. They don't get that right, and they have to give multiple attempts. So it's sad in a way, but yeah, they're quite strict about operative dentistry skills.
Do you have any suggestions for them that suppose they are in India? Do you think attending Indian courses are better, or attending a course in UK is better for preparing for this exam?
For the exam, I would say doesn't matter where you are. People prepare for the exam in their houses here. I have done it. I had a mannequin in my home with a compressor. So preparing for that exam is up to you. I mean, it's an individual's journey, what they want to. If you're saying about clinical dentistry later on, if they want to do a course in prosthodontics, just 1 day, 2 days, I know people have 5 days courses in India. Yes, so doesn't matter where. All they want is you have to be a safe dentist here. For the ORE, you can prepare anywhere in the world. On the day of exam, you need to deliver what they are asking you. That's it. It doesn't matter where you have prepared. It just they have strict criteria, and the calibration of that exam. This is what I want people to understand. UK, they are very calibrated, they're very systematic. And I promise you, if you've done something right, they tick you right, they mark you right. There is no rocket science to it. It's not unfair in a way how people sometimes think, oh, that person was not as good as I was, and he has passed the exam, and how come I did not know? This exam is not fair. I promise you, it's calibration. That person might not have prepared good cavities when they were practicing, but in the exam, for the examiner, he has ticked all the boxes, and it's all about that. So your question was where to prepare. Doesn't matter where to prepare. On the day of exam, you need to deliver what they have asked you for.
Okay. Do you think, I know coaching everything can help. We do teach students. I have made a video on class 2 where I have explained all this clearance, why to break contact, reverse curvature. But in spite of making all these videos and teaching, sometimes students do not understand it. I don't know whether it is the fault of the teacher, because the more and more we are teaching, the less and less the students are understanding. So either the way we are teaching should change, or maybe there is other, I don't know, I'm trying to find the reason.
I think, Shenvi sir, I'm sure you're a very, very good teacher. And I used to do the same when I used to go to people's houses and literally catch your hands, and I used to, teach them. But what happens is the exam pressure. I do think people need to mimic the stress conditions what they have in the exam. Also, teeth in the exam are softer. They're very fresh. I don't know, they use a different kind of teeth. So when you punch the first hole, you can actually dip it really down. But all these things, there are a lot of things. And the most important factor is the stress. I think the nerves need to be really calm in the exam. You need to have a strategy in your head, and you need to have, you can't cut a crown for 2 hours and expect to pass the exam either. You must have made the most beautiful crown. But if you want to work as a dentist in the NHS in the UK, where you're seeing 4 patients in an hour and you're doing crown prep with impression, with temporary in 30 minutes, and you take 2 hours in the exam to do a crown prep, it's not a pass, unfortunately. You must have had the perfect crown prep done. So it's about the exam pressure, it's about the time, it's about what you deliver in what amount of time. And I think it's all about strategy. It's not fluke, it's not luck, it's about having a strong strategy and focus, and going forward with the exam.
So my question is, whatever we're teaching in second year or dentistry in India, like we do tell them clearance and all, do you think, is there any something which we are not teaching? Like, I understand stress is something which which may be different in different places, but do they expect something different than this, or is it exact? Because I have given US exam, I have given Dubai exam, and although they are theoretical, I feel it's the same thing which is asked. Okay, when I tell my students that this is how class 2 should be, but people don't do here, and they go to US and they take a course to learn the same thing. Is it really different in foreign courses, or it's the same thing what we learn from the student?
See, I don't know what, obviously I got to know from you for the first time.
No, you remember your UG days, isn't it? You remember your UG days, you have cut a class 2 as a UG, and you have cut a class 2 in ORE. What was different?
I think they are quite strict with the criteria here. There is no room for error when it comes to mannequin. And I'll tell you, one of the things is, even if you make a slight scratch on the neighboring tooth, that's seen as negligence, because that patient can come back after 2 years saying, I've got a cavity in the tooth next door, and it's not the patient's fault. So they'd see that as, an iatrogenic mistake. And if you don't raise that to your examiner, that yes, you've scratched the neighboring tooth, and your cavity is perfect, what are you going to do about it? How are you going to communicate to the patient? What if the patient gets angry and say, how could you do that to my neighboring sound tooth? These are the things they're quite strict about, which that's why when candidates start learning mannequin here, they know that they're going to take time to completely learn the way they want them to learn here. Because there are strict rules about the dimensions, about the errors, the mistakes, the pass and the fail, criteria that they have. But class 2 is class 2. As I said, dentistry is dentistry. Again, there can't be different dentistry in 2 different parts of the world. It's these little things. They are very strict about patient care. And any iatrogenic damage in real life can actually be a litigation, a complaint against the dentist. So they take these things very, very seriously.
Is the loop compulsory? Because I'm a big fan of magnification. I've been telling my students, but I think India is lagging behind. The colleges are not so keen on pushing the undergraduate students to use loop. One very important thing, as you mentioned, that if you don't want to damage the adjacent tooth, you have to work under a loop. Majority times we don't see it. If you don't see, you don't know even you have damaged the tooth structure. Right. So, do you think undergraduate students who plan to go for UK should work, because postgraduates definitely work under loop? Do you want to motivate the undergraduate students to work in loop so that the UK exam becomes?
I think right from the diagnosis, now I've become a big promoter of loops. Right from the diagnosis, there are so many things, even in the diagnosis aspect, you miss out if you don't wear loops. And I think right from diagnosis to the end of treatment, any dentist anywhere in the world should actually wear loops, because I've seen the difference. I've seen the difference in my diagnosis. I've seen the difference in my simple fillings, basically. Even in scaling, you can see simple difference if you wear loops. So I'm a big promoter of loop. And if you ask me, I would say every dentist should work under magnification. Yes, it's in a way, if you're doing like NHS dentistry, quantity dentistry, you're seeing too many patients. Yes, in that one position with the loop, you might have stiffness, you might have issues. But when it comes to dentistry, I think loops make a lot of difference. In fact, now in the UK, they've started using microscope. They're working under microscope. That's even like one step ahead. But generally, I personally would not get treated by a dentist who is not wearing loops. That's how.
Students
that's where
in the exam all the students work with loop, or you can even do a class 2 without a loop?
They do without a loops, but I think if from the current environment that I'm seeing, UK is a big they promote loops a lot, and like there are forums in which they say don't ever go to a dentist who is not wearing loops. However, it's obviously we understand that some dentists don't prefer loops, and it's a lot of strain in their eyes as well. I have friends who don't like, and it's not that their dentistry is bad, but personally I think loops make a lot of difference to your dentistry.
Okay. So that is the very important question which you answered, that what you learn, dentistry is dentistry anywhere. It's just the mindset. So after this, once the people clear the GRE, now what is the scenario? Do you think the job opportunities, because post-COVID, is the job opportunities better, or is it very difficult to get a visa and everything now? Do you have any update regarding that?
Actually, COVID has made it very easier for overseas dentists, and also Brexit, because since Brexit and COVID has happened, they open doors, and that's why they open hygienist and they opened the therapist door, because they needed workforce. In terms of obviously exam, yes, it has become scarce because they're planning on new ways of getting dentists here. But once you pass the exam, I think there is enough job. And Suresh sir, I want to be loud and clear. Please get in touch with people like me, people like IDA. We have an Indian Dental Association in UK. It's run by Dr. Biju Ramachandran. He's from the South as well. He is the president. Please get in touch with people who have been through the struggle so that they can guide you, they can help you. And if you know the right people, you will go farther, but you'll also go fast, because like they say, you can, if you're alone, you'll go fast, but if you get in touch with people, you'll go far. So why not take help when there is so much help, there is so much support? We love supporting the community, we love supporting our fellow dentists who want to come and practice, because it's always nice to know someone wants to be a part of your community. And I would say, yes, if you work hard, if you know the right people, you get in touch, if you are on it, if you're focused, there is a strategy, you will get a job. I haven't known people being jobless or not finding a job. I haven't known anybody. There's some or the other way. Just get in touch with the right people, whether it's through me, through IDA. There are so many people who are so happy to help.
You do have a Indian Dental Association in UK, and this is surprising because I thought the idea is only in India. Can you tell me something more about it? Will it help someone who is a member in India can directly get a help from the IDA UK, or they have to become a member of IDA UK?
I would suggest, like, if you're in the UK, process or preparation stage, do get in touch with IDEA UK. They are very genuine, very helpful people. Dr. Biju, Dr. Shivani, Dr. Noori, Dr. Romit, Dr. Monis, all these guys, like genuinely, even on outside IDEA, they help people. They help, Indian dentists to come to UK in terms of jobs. They know people. They know so many corporates and people who they can help them, getting sponsorships and jobs. Because as I said, visa is very important. If you don't have a visa, how are you going to practice? So there are a lot of people out here who are ready to help people, with visa as well. They sponsor them. They bring them on sponsorship, and they can practice dentistry here. IDEA UK is not a part of IDEA, the idea that we have in India, but we are very glad that we have someone, an umbrella that supports Indian dentists. And Dr. Shenvi, I think that is the difference between the work-life balance in the UK when it comes to even dentistry is very different, because this small little community of ours, we do so much outside dentistry. Forget the professional development courses or the lectures or the webinars they have or the workshop they have for us, but they also have events wherein you socialize, you network, you meet your fellow dentist and you meet someone else. And they say your net worth becomes your network. So your network is what makes your network, and then you grow faster. So please do get in touch. Dr. Biju is aware that I will be speaking about IDA with you. I have taken his permission, and any dentist who wants to basically get any advice or needs help with jobs, needs help with the exam, do get in touch with them. Obviously, I am there. I'll put in my details as well. But we do have an organization. We have a lovely community here. There is a lot more I can speak about. Other communities like Bollywood Dentists, which does Bollywood events, and it's more extracurricular. But yes, we do have these little communities here that help our dentists, and it makes just life easier, because it's not just dentistry. You need that emotional support, that growth, those kind of people around you, who understand your struggle and who empathize, and who are compassionate towards you. So yes, I have a family here, and we have a very lovely family here. So do get in touch with IDA UK. They have a website. um, the entire panel is in there, the email address is in there. And yes, if there is any help needed, I and IDEA UK are here to help you. So get help from the right sources, because one more awareness we need to create is there are a lot of university or courses that promise dentists that we're going to give you this, and once you come here you do a course, and they are expensive. They're really expensive. Do not go for any course unless you have a confirmation from the GDC that yes, this course can let you practice dentistry in the UK. There is nothing but ORE and LDS that allows you to practice dentistry. If you or your family has got a lot of money that you want to study dentistry in the UK, then get into clinical dentistry. At least you get if you pass your ORE or LDS, you become a specialist. But do not do any other courses that promises you to practice. So get in touch with the right people. We are here to help you.
Yeah. So there is one question which students ask me, that can Indian dentist or any foreign dentist, can they get into a specialty course? Like for example, can they directly become an endodontist? Because I believe GRE gives a
ORE.
general dentist. Sorry, sorry, ORE gives the general dentistry license. But let us assume that I want to become an endodontist in UK, or either directly, or I want to be recognized or do something to become recognized an endodontist. What are the pathways for it?
So as an endodontist, obviously you finish your exams if that's going to be continued for the rest of the year, ORE or LDS, you give those exams, right? And then there is one way of trying to see if you can register as a specialist in the GDC register, which is they ask you for your curriculum. There is a small assessment, it's like probably a viva. Basically, you have to show equivalence of your degree and your experience back in India as an endodontist. And I know a few friends who have directly become specialists in the register after they have finished their ORE. It was prosto, it was pedo, it was endo. Yes, they could get into the register just by showing that it's quite equivalent from what they have studied and practiced back home. So there is a way, there is a shortcut, but most of the times what happens is it's strict. It's very regulated, so you've got to be careful with the equivalence, what the kind of equivalence you show. But it's tough, but I know people who have done it directly. The other way of doing is spend a lot of money, get into Clinton or these master courses, and yes, then after that there is a small exam that you give, and you get into the register basically.
Yeah, thank you for that information. And I have one very important question, that It is, I think 2009 you graduated, and it is 2023. I hope you had a wonderful experience at our UG institute, our institute, where I'm currently a faculty from past 11 years. But if you go back, you go back to that 2006, 7, what else you would have done, which could have helped you better today?
I don't think I was better today. I think Kelly has been like wonderful. It's outstanding in terms of education, the amount of patients we do. I I don't think I would change anything. Nothing. It's outstanding as a university. The staff, right from Kale ma'am to every junior lecturer we had, the vivas, it's perfect, and it preps you well for the real world outside. And of course, there were students who didn't take it too seriously, but even they are doing quite well in their life right now. I think Kelly is outstanding. I was very lucky to be in be one of the students of such a bright institution with such a good support system. So I wouldn't
Is
change
there any
anything.
something like you feel, because I know, as I was a student, we did not do a lot of paper presentations. We did not go for more. I don't know whether you went, but now the university is more open. Like, students are encouraged. The opportunities are more. The students have to come forward. But do you think doing all those things help them? Not in this exam itself, but is it beneficial in some way in UK? Or some interview,
Yes.
if there is any interview. Do you have any interviews anywhere?
Yes. So I think the most important thing I would change is, see, I wanted to be a dentist, and that's why I'm happy being a dentist even today. But I know for a fact that someone who just got into dentistry because they had no other option will not feel the same about the profession. Especially if you're coming to UK, it's very different. I'm sorry, I will sound a bit negative, but the system here is quite strict in terms of litigation. You have to, as I said, you are a dentist, you are a doctor, you are an artist, scientist, but you are also a lawyer, because every patient has to be seen and documented in a way that they are going to sue you. So yes, that ways I had to become more brave. As I said, I had to do more leadership courses. I had to work on, I was an introvert, I was shy. I had to work on those things because that's not what how you present to a patient, especially in a different culture. But yeah, the most important thing I would change is how people get into dentistry and why they get into dentistry. They shouldn't go into dentistry just because they did not make it to anything else. And here, that's why they give them a taste of the profession before. And students are assessed on basis of a lot of things, because now I am also a clinical teacher at King's. And one thing that I did not, you don't have on my resume, is last week, and since a month actually, I've been interviewing candidates who are getting into dental schools, and I see they have to do work experience. They can't get into dental school if they don't have that experience of working with a dentist, or under shadowing a dentist and seeing what it actually entails to become a dentist. They have to pass the manual dexterity exam, in which their hand skills are also checked. So I think it should start from ground level, because if from there, and then it's a journey. So well, but it will take time, because, and that's the difference between the education system, I think, in both the worlds. We are quite nerds, we are good with memorizing and mugging and passing exams and stuff, but there is a lot more in the profession that needs assessment for. Here, two things are very different. They give a lot of importance to mental health. They give a lot of importance to medical legal. Every dentist here has to be insured as well, which I don't think is the case back home. There are, again, I wanted to touch a little bit more about the kind of practice we have here. It's a mixed practice or a private practice. The mixed practice is subsidized for the people, but also in a way, say for example, a patient comes to me for 10 fillings or one filling, I'll be paid the same amount of money. So that's NHS dentistry. It's subsidized for the people. So it's it can de-skill you over the time, because it's so quantitative. You have to produce and produce and produce dental activities. I wish I could speak more, if you want to give a brief idea to people. Like, yes, grass is always greener on the other side, but there are other things involved in the profession as well. So an average dentist from back home can come in a system that's safe, and it's quite systematic, it's quite robust, it's quite robotic as well. It's guideline based, but then at the same time, it's not what we've been doing back home. Chalta hai attitude, karenge dekhenge, YouTube se seekhenge. It's not like that. If you make a mistake, a patient can actually, take you to court, and it's quite daunting then, the whole patient journey for you.
But I fail to understand it because whether you are an international student or whether you are a student from UK, I think mistakes will happen, isn't it? It's not possible that the mistakes will never happen. Um, but how do they? I mean, how does this process go? That mistakes will never happen, or
Say
what
for
is the way you project like?
I'll just, because you're an endodontist, I'll give you an example of endo, right? You have a tooth that needs an endodontic treatment. There are certain guidelines wherein you as general dentist can treat it or refer it, okay? Now, you can be a hero to a patient and say, you know what, I'll do it for you. And if it's NHS, you don't even get paid much for doing that endodontic treatment. But you're like, no, I'll try and save it for you. And say your endodont, it fails. And you are, asked to justify why you did that endodont. It doesn't happen all the time. I'm just saying, but if you haven't told the patient about the risk, you have not documented that, you've told the patient it's close to the bone, it's subgingival, the root has a curvature, the patient has denied seeing a specialist, and even if the patient has to see a specialist in the hospital, they have to wait for months until the referral goes through on the national health, or else they go privately. So there are too many, there is a system, and there is a system to their madness, and you have to follow it. You have to follow the guidelines. You have to justify why you did something the way you did it. And, it's a lot of justification and documentation. Imagine telling a patient, well, smoking, you've got gum disease, and, you shouldn't be smoking. And then you document it, and then you talk about sugar in the diet, you talk about alcohol, you talk about stress levels, how their medical, like for example, diabetes affects, and you say all that, and you make sure they understand it. And then you go back to your notes and write everything down and show basically to whoever that, you're a safe dentist and you've not been negligent, and you've told the patient everything, and it's up to the patient now. So it's too much work on
But
daily
isn't that
basis.
very stressful? Isn't that too stressful? And I have a very important point. I think you did mention that you don't practice every day. That is something new for me because we are practicing throughout the week. You did say that you decide when you want to on few days you take, and then few days you have your own activities or hobbies. That's something nice. And how does it work? Like, are the people willing to hire someone that whom they want, like who decides to work 1 or 2 days or 3 days or 4 days in a week?
So I'm a bit different. I've always thought of outside the box. So I don't think I follow the crowd. Usually what people do is they become associates. By associates, I mean they work for someone in a practice for 3 days, 4 days, 5 days, depending upon, see, as a dentist in the UK, there is no limit to how much you can make. You can make as much as you want. The more you work, the more you upgrade yourself, your skills, you start doing private, because as I said, private is quality, but there's money involved. You need to be confident enough to do private dentistry as well, because there's a lot of money involved. And I can talk about the working culture of dentistry in the UK in a completely different postcard, because that's something people think is okay, ORE, LDS, come to UK and practice. But then after they join the practice, they say it's a completely different game. The patients, the culture, the whole system, your obligations towards your registration every year, it's a completely different game. So I think I wanted to have a bit of both. I wanted teaching. I wanted, that 4-room every day, 5 days in a week was not it's as good as an office job then. Although it's exciting, I love dentistry. I love seeing patients. I love talking to them. But then it gets monotonous, being in one place. So I chose to do locum dentistry. Now, locum dentistry is completely different. You go to places where they need you. You practice for a day, sometimes for weeks. Whatever you can let them know how much you want to work for them, and that's it. If you're not on a contract, you don't have obligations. But it's hard. It's hard to do what I do because there's a risk involved. Say I see a patient, I open the tooth up, and I've dressed it, and then I don't go there, and the patient is in pain. It becomes, the patient is, I become liable for the treatment. Every patient is a liability for that dentist itself, not the practice. Because when a complaint is made against the dentist. It's never the practice. So yes, locum dentistry is tough. It's risky, but I like variety. So I do it. I will do it until I can and until I think I'm being safe. However, it's up to you how you want to practice dentistry. There are so many other roles, but again, networking as overseas dentists, we have a lot of internal barriers. We always feel like second citizens in the country and in the profession, because we always see them as if we are foreigners, and we are trying to get into the system, get into the culture. Plus, personally, I think we struggle a lot as well, because we come from a very safe, emotionally supportive network, and then we leave everything behind and start this new life. So that personal stress is also a lot on dentists. And they did a survey recently. The profession has got one of the highest rates of mental health problems as well, and that's because of the pressure of the system, of you following all these guidelines, and practicing evidence based, and protecting yourself and protecting patients. It can be stressful, and that's why I think people need to understand that part of it. Like, it's not about just nailing the exam. Yes, we are very good with exams, we are very good with paying money and getting into courses and stuff, but what after is what you're going to 30-40 years of your life you're going to be in a system practicing this kind of dentistry. So I would love to speak about that, but it's a completely different podcast.
Okay. So one last question. I think you have mentioned it, but I just want to end it that way. That what is the not just dentistry? What is the most important thing which you miss in UK, which is compared to India, apart from
you
dentistry?
You want me to cry now? No, no. I think the most. I have everything here. I'm in a place, in a system, here people actually follow live and let live. We say that a lot in India, but at the end of the day, there is social pressure, anxiety, expectations, family, friends. Here it's completely different. But again, I think that's the downside as well. Like, you're upset, you don't have someone come and tell you it's been few days, I haven't heard from you. Are you okay? That's where your friends. That's where I've had this strong bonding with with people around. And it boils down to individual, because you could be someone who's not friendly. You will struggle, because then your only option is your family, whoever is around you in your house. Everyone is in their own world, in their own business. So I think that's what I miss the most, having that support network of your family and friends. And you don't make the same kind of friends after a certain age. I don't think that's there. That your old friends are your old friends. However, I have made some amazing friends here. So I would say I have a family here in the form of friends, in the form of communities. As I said, there are a lot of communities. Get in touch, be a part of the community, and you'll never feel, that you're missing out on a lot. And then obviously, Shenvi sir, we know how it is. You are your own cleaner, driver, you do your own laundry, you do your own cooking, you do your own cleaning. I mean, who doesn't miss all that from India? So
Very true.
yeah, life
Very true.
is very, very tiring here. That's why, the culture of holidays, people love going on holidays. People love weekends. They live for weekends here. And I never understood why. It's just because your day to day, you're like a robot from morning to night.
That's a wonderful listen. I had the amazing time to listen to your journey, and I'm sure we can have many more podcasts on various topics, various certification which you have done, and hopefully in future we'll have some better news. I want to thank you again for giving me your time, and it was so good to talk to you after so many years.
Yes, thank you so much. And can I just request, please, whoever is listening, get in touch with people. People are here to help you. It's always better if you go through a reliable source, so that you know where you're going, and it will be easier for you and faster for you. So do get in touch. I do it voluntarily. I'm happy to help. So yes, all the best to whoever is planning to come to UK. I'm looking forward to hearing and seeing you and practicing with you in the UK, actually.